Losing a limb to amputation is a life-altering event, bringing with it a host of physical and emotional challenges that can be overwhelming. As individuals navigate this new reality, the desire to regain independence and mobility often leads them to explore the world of prosthetics, which can offer a new lease on life. A well-fitted prosthesis can significantly enhance quality of life, allowing individuals to participate in activities they once enjoyed, from simple daily tasks to more complex recreational pursuits. However, the journey to successful prosthetic rehabilitation begins with a crucial step: a comprehensive assessment of the amputee stump, which lays the groundwork for everything that follows. The stump, the remaining portion of the limb after amputation, serves as the foundation for the prosthesis, and its condition is vital to the success of the prosthetic fitting. It is a dynamic site, constantly adapting to its new role, and understanding these changes is essential for creating a prosthesis that will work effectively. Understanding the unique characteristics of each individual's stump is paramount in fabricating a prosthesis that is both comfortable and functional. Tailored to the specific needs of the user, stump assessment involves a thorough examination of various aspects, including skin condition, which can affect how the prosthesis fits and feels, shape, muscle strength, and sensory feedback, all of which play critical roles in the overall success of the prosthetic device. This assessment is not merely a formality, it is the cornerstone of the entire prosthetic fitting process, ensuring that the prosthesis will be as effective as possible. By identifying potential issues early on, such as skin irritation, muscle weakness, or areas of sensitivity, clinicians can address these problems before they become major obstacles. This allows them to tailor the prosthesis design and fitting process to meet the individual's specific needs, enhancing comfort and functionality. A thorough assessment minimizes the risk of complications such as pressure sores or improper alignment, optimizes prosthetic fit and function, ensuring that the device works seamlessly with the user's body, and ultimately empowers individuals to achieve their mobility goals, giving them the confidence to move forward with their lives. In the following sections, we will delve deeper into the key components of amputee stump assessment, exploring their significance in the context of prosthetic rehabilitation and how each element contributes to the overall success of the process. Understanding these aspects is crucial for both healthcare professionals and individuals with limb loss, fostering a collaborative approach to achieving the best possible outcomes and ensuring that everyone involved is working towards the same goal of prosthetic success. The skin, our body's protective barrier, takes on paramount importance in amputee stump assessment. It is the first line of defense against external threats and plays a crucial role in the overall health and functionality of the stump. The amputation site, often marked by a surgical scar, represents an area of vulnerability susceptible to various skin conditions that can significantly impact prosthetic wear. This scar tissue, while a natural part of the healing process, requires careful monitoring to ensure it does not become problematic. A thorough examination of the skin is essential to ensure its health and integrity, paving the way for comfortable and trouble-free prosthesis use. This involves not just a visual inspection, but also a tactile assessment to detect any underlying issues. One common concern is the presence of scar tissue. Scar tissue can vary greatly in its characteristics, from being soft and pliable to hard and restrictive. While scars are a natural part of the healing process, excessive or adhered scar tissue can restrict movement and cause discomfort, particularly when pressure is applied by the prosthesis. This can lead to significant challenges in achieving a proper fit and function of the prosthetic limb. Skin breakdown is another potential issue, especially in areas where the prosthesis socket comes into contact with the stump. This can be exacerbated by factors such as moisture, friction, and prolonged pressure. Constant rubbing or pressure can lead to redness, blisters, or even sores, delaying prosthetic use and increasing the risk of infection. These issues can be particularly troublesome as they may require extended periods of rest and healing. Other skin conditions, such as dermatitis, folliculitis, and fungal infections, can also arise on the stump. These conditions can be triggered by various factors, including hygiene, environmental conditions, and the materials used in the prosthesis. These conditions can cause itching, pain, and skin breakdown, further complicating prosthetic wear. Managing these conditions promptly is essential to maintain the health of the stump and the comfort of the amputee. These conditions can cause itching, pain, and skin breakdown, further complicating prosthetic wear. Addressing these issues early can prevent more severe complications and ensure the longevity of the prosthetic device. Identifying these issues early on allows for timely intervention, preventing them from escalating into more serious problems. Regular checkups and assessments are key to catching these issues before they become severe. Careful observation and palpation of the skin are crucial during stump assessment. This hands-on approach helps in identifying any abnormalities that might not be visible to the naked eye. The clinician examines the color, texture, and temperature of the skin, looking for any signs of redness, swelling, warmth, or tenderness. These signs can indicate underlying issues such as infection or inflammation. They also assess the scar's mobility, ensuring it is pliable and not adhered to underlying tissues. This is important for maintaining the flexibility and comfort of the stump. Any abnormalities, even seemingly minor ones, are documented and addressed to prevent complications down the line. This proactive approach helps in maintaining the overall health and functionality of the amputation site, ensuring the best possible outcome for the amputee. The shape of the amputee stump plays a pivotal role in determining the fit and function of the prosthesis. Unlike a healthy limb with its natural contours, a stump can present unique challenges due to its altered anatomy. Understanding these variations in shape is essential for fabricating a prosthesis that fits snugly, provides adequate support, and allows for comfortable movement. Several factors influence stump shape, including the level of amputation, surgical techniques employed, and the individual's healing process. For instance, a transtibial amputation will result in a different stump shape compared to a transfemoral amputation. Similarly, surgical procedures that preserve muscle length and minimize soft tissue trauma can contribute to a more favorable stump shape for prosthetic fitting. Variations in stump shape can pose challenges in achieving a secure and comfortable fit for the prosthesis. A stump with prominent bony prominences, for example, requires careful consideration to avoid excessive pressure points within the prosthetic socket. Conversely, a bulbous or edematous stump may necessitate a larger socket size or modifications to accommodate the increased volume. The clinician meticulously assesses the stump's shape, taking measurements and noting any irregularities. They pay close attention to areas of muscle atrophy, skin folds, and bony prominences, as these factors can influence socket design and fitting. The goal is to create a prosthesis that distributes pressure evenly across the stump, minimizing the risk of discomfort, skin breakdown, and impaired circulation. Section 4, Muscle Matters. Evaluating stump strength and control. Muscles play a vital role in controlling limb movement, and after amputation, the remaining muscles in the stump take on new importance. These muscles, although no longer controlling a foot or hand, are responsible for moving and positioning the stump, which in turn dictates how the prosthesis functions. Assessing muscle strength and control in the stump is crucial for determining the individual's ability to operate the prosthesis effectively. Muscle atrophy, or the wasting away of muscle tissue, is a common concern after amputation. This can occur due to disuse, nerve damage, or inadequate blood supply to the muscles. Weakened muscles compromise stump stability, making it challenging to control the prosthesis and perform everyday activities. For example, weak hip flexors in a transfemoral amputee can hinder their ability to walk with a prosthesis, as these muscles are essential for lifting the leg during swing phase. The clinician evaluates muscle strength through a combination of observation and manual muscle testing. They observe how the individual moves their stump, noting any limitations in range of motion or signs of muscle weakness. Manual muscle testing involves applying resistance to specific muscle groups while the individual attempts to contract those muscles. This provides a subjective assessment of muscle strength, graded on a scale to indicate the level of function. Section 5. The sensory landscape, mapping sensation after amputation. The loss of a limb not only affects mobility, but also disrupts the intricate network of nerves that carry sensory information to the brain. This disruption can have profound effects on the individual's overall sensory experience. This disruption can lead to a variety of sensory changes in the stump, ranging from complete numbness to heightened sensitivity or phantom limb sensations. Phantom limb sensations are particularly intriguing, as they can make the individual feel as though the missing limb is still present and even moving. Assessing the sensory system of the stump is crucial for understanding how these changes might impact prosthetic wear and function. A thorough assessment helps in tailoring the prosthetic to the individual's specific needs, ensuring better comfort and usability. Phantom limb pain, a common phenomenon after amputation, can manifest as a variety of sensations, including burning, tingling, cramping, or the feeling that the missing limb is still present. This pain can be persistent and debilitating, affecting the individual's quality of life. This pain, while originating in the brain, can significantly impact an individual's ability to tolerate wearing a prosthesis. The discomfort can make it difficult to wear the prosthesis for extended periods, limiting mobility and independence. Hypersensitivity, where even light touch or pressure causes discomfort, can also pose challenges in prosthetic fitting and use. This heightened sensitivity can make it difficult to find a prosthetic that fits comfortably without causing pain. Conversely, areas of numbness or reduced sensation on the stump present their own set of concerns. Numbness can make it difficult for the individual to detect issues with the prosthetic, such as improper fit or pressure points. Individuals with diminished sensation may not be able to detect pressure points or skin irritation caused by the prosthesis, increasing the risk of skin breakdown and infection. Regular monitoring and care are essential to prevent these complications. Additionally, lack of sensory feedback from the stump can make it challenging to control the prosthesis and perceive its position in space. This can affect the individual's ability to perform tasks that require precise movements. Sensory assessment involves a combination of subjective reporting from the individual and objective testing by the clinician. This comprehensive approach ensures that all aspects of the individual's sensory experience are considered. The individual is asked to describe any unusual sensations they experience in their stump, including pain, tingling, numbness, or temperature changes. These descriptions provide valuable insights into the individual's sensory experience. The clinician then performs sensory testing, using various tools to assess light touch, pressure, temperature, and vibration perception at different points on the stump. This detailed assessment helps in creating a comprehensive sensory map of the stump, guiding the development of effective treatment and prosthetic solutions.